Hello. When speaking about varicose veins, we speak about a mechanical problem of the veins. In veins, speaking about legs, the blood goes from down, upwards, from legs to heart. To be able to do so, in these veins we have valves this way. These valves open, blood goes up, and after that they close, so the blood will not fall down. Varicose veins, in the simplest definition, is when these veins dilate, that valves are not able to close properly. I stand up, the blood falls in these veins, hit the tissues in the lower calf, causing repetitive trauma. That repetitive trauma on the tissues on the lower calf in time will lead to inflammation, symptoms in some people. The skin in the lower calves turns in red. After that, if left, will turn in brown color, loses elasticity, and if left, will lead to ulcers. We call that passive reflux, or I stand up and the blood falls in a free fall. On the other hand, between the superficial secondary venous system, that if sick called varicose veins, and the deep, big main venous system, we have communicators that we call perforators. In these communicators, in these perforators, blood goes from the surface to the deep, from the secondary venous system to the main venous system, from the low blood pressure to the high blood pressure. Liquids normally goes from high blood pressure to low, but in veins everything is upside down. When these perforators are dilated, that valves are not working properly, the blood starts to flow in the wrong direction from the high blood pressure to the low blood pressure, causing again repetitive trauma like a punch per step in the superficial venous system and surrounding tissues, the fat and skin. That repetitive trauma again in time will lead to complications and ulcers. Saying so, we can see that varicose veins is not a bacterial infection, it's not a virus, it's not a fungal infection. So taking tablets, ointment, creams, herbs, teas, I don't know what other medications or products found in the market, all these are simply nonsense. Once we have varicose veins, once the valves in the veins are not working properly, the only way and the only scientifically proven way to get rid of the illness is to get rid of these veins. How to get rid of these veins? That makes the difference between old-fashioned methods with high risk of recurrence and newer methods scientifically proven to be effective. I'm Dr. Omar, and remember, if you have varicose veins, no matter how bad or advanced is your case, it's really easy to get it treated, but things should be done properly.